Now, with regard to market trends, what we've seen in the marketplace, SureScript released its National Progress Report in May, and they found a huge uptick in the adoption of ePrescribing, and guess why? We've got sticks coming now. So 58% of office-based physicians were using ePrescribing by the end of 2011. 82% of that 58% were doing it through EHR technology. Now, they may not be using anything else in the EHR, but they are definitely ePrescribing through their EHR. When we look at the top 5 regions for EHR adoption, you're getting up into the New England states and Massachusetts. If you come across the Canadian border, you've got Minnesota, Wisconsin, and North Dakota that had high adoption rates, followed by the Northwest Pacific with Oregon and Washington, and then you've got Arizona and North Carolina. Those were your highest top 5 regions for adoption. Interestingly enough, 36% or over 170 million prescriptions were routed electronically last year, and that's quite an uptick from 2010 at 22%. We've also got a quality improvement factor, and so this is where we're starting to see how health IT can improve quality. The first fill prescription adherence rate went up. With the increase in ePrescribing adoption, it went from 69.5% in 2010 to 76.5% in 2011. So there is a quality factor for getting on this type of technology and workflow. Continuing with market trends, 60% of your early adopters, which were the ones that came out of the gate with it in 2008, have met the stage 1 ePrescribing meaningful use, but even more importantly, 38% of those early adopters would already meet the proposed stage 2 ePrescribing meaningful use measure. In that proposal, that's things like formulary checking, medication history, refill management, so more advanced use of ePrescribing. The top 3 specialties that had growth rates, internists jumped way up there, and you saw the stick hit, so we went from 45% to 81%, family practice from 47 to 75%, and cardiology from 49 to 76%. When we look at practice size, where you see the highest trend of adoption in 2011 is the size that ranges from 2 practitioners all the way up to 10 practitioners with prescriptive privileges. So that's your biggest curve there. Your top 10 specialties for adoption rates in 2011 break down like this. Internists were number 1 at 81%, followed by endocrinology, cardiology, family practice, gastroenterology. We had a tie at 68% between psychology and urology, and we had a tie at 67% between optometry and ophthalmology and neurology. And then you have dermatology, otolaryngology, and then pediatrics.